So, good morning, sir. I am Divine Grace Jugasan from 11H section. So, for today, sir, I'm going to assisting. So, first, I'm going to introduce myself, verify the client's identity, and uh, explain the procedure. To ensure that the clients know his identifications and also will address the patients. So, good morning to mom. I am Divine Grace Jugasan. I am and so today I have your
I'm gonna be born in 2006.
so for today po ma'am is I'll be assessing the temperature po. So I'll be monitoring if you have a fever or also but we ask we ask assessing condition of the climate of you. So now is I'm gonna perform hand hygiene using the alcohol and uh, observe the infection control and ungloving to prevent spreading of infections. So now I'm gonna sanitize my hands using the alcohol. Also, object that gloving to ensure both of us patients is protected from any infection. Okay, so I'm not done gloving. So now I'll provide the client's privacy to maintain the dignity of the patient. So now for mom, I'll be closing the door for mom to have your privacy and also inspection for idiots. So now I'll provide or position the client's appropriate or comfortable position. So now po ma'am is sit comfortably po to assess your temperature later po ma'am with your feet on both feet flat on the floor. So as if the posi- of if the support position need later po ma'am, I will help that position later po. So now is I'm gonna uh, clean the thermometer to using the full swab to ensure it is clean to use. Okay. So now is I'm done reading the thermometer. So now is I'm gonna place the thermometer in the selected method or yeah selected method like axillary, which is I'm gonna put the thermometer under arm of the patient, which is skin to skin contact to ensure the accurate reading of the temperature of the patient. So now let's proceed to axillary temperature, which is first is I'm gonna move up the sleeve of the patient away the arm or shoulder and ask the patient to raise her arms to inspect the axillary area if there are any lesions or any uh, perspiration to ensure that it's free from the obstructions and it is secure to before taking the. So now I will now put up your sleeve program. Picture the accurate reading. So now can you please raise up your hand movement so now if you were underarm puma for any lesions or any signs of perspiration puma. So if puma, there is some signs of any skin issues before taking a temperature. So stay still up more. So now is I'm gonna picture the patient's underarm for a especially if it is a moisture. And also, I'm gonna put the tip of the thermometer in the center of the axillary area and ask the clients to put down the arm and press it to the chest. And I will turn on the thermometer. So moisture can affect the reading of the temperature, and also proper positioning ensures the accurate reading of the temperature. So now, Puma, I will put your underarm Puma using the tissue Puma to ensure the accurate reading of your temperature. So now, as I'm gonna put the tip of the thermometer in your center of your axilla Puma, and please put down your arm across your chest. So now I'll start on the thermometer. So now we will wait the appropriate amount of time after the placement of the thermometer to ensure that thermometers have amount of time to obtain the accurate reading. After that, I'll remove the thermometer and tell the clients about her temperature to ensure that the clients know about her health conditions. So now Puma will wait the amount of time Puma until the thermometer reads Puma uh, indicates that you are, yes, it beeps low, indicates temperature is really low. Okay, Puma, so your temperature Puma was 35.9, which is in the normal range. Oh. So now is I'm gonna wipe the probe and thermometer sensor using the alcohol swab. Yeah, here alcohol swab and ensure it in the from the seam of the probe or thermometer sensor in the firm twisting motion, and I will remove the gloves later and discard it and have have a perform presentations to ensure of the cross contamination with the patients. Now is I'm going to clean the thermometer in the firm twisting motion. Okay. So now is I'm going to remove the gloves. So now I'll perform hand hygiene using the alcohol. So now I will record the patient's temperature in the sheet of in the minute book, and also check the temperature of the patient if the temperature is inconsistent or um, too high, too low, or inconsistent of the client's conditions to ensure the accuracy of the documents for future reference. So now I will document whether your temperature was a 35.9 Celsius. So now is I'm gonna wash the thermometer and return it to the proper storage locations to ensure it is cleanliness and also readiness for future uses. So we just imagine I already washed the thermometer and place it to the proper place. Now is I will document the thermometer, the temperature of the patients on the worksheet or the patient's report to ensure the accuracy or the monitoring of the patients. Okay, so now let's proceed to the verifiable pose. So first is I'm gonna perform the step 1 to 3 in the assessing the temperature. So first is I'm gonna introduce myself as verify the client's identity and explain the procedure to ensure the client's correct identifications are also build a trust to a patient. Good morning po, ma'am. I am Divine Miss Jugasan. I'm a nursing student. So for verification po, ma'am, I have your name and birth date po.
I was born in April 2000.
Okay, so for today po, ma'am, I'll be assessing your vertical pulse po, which is in your radial pulse po, ma'am. I will gently put my 2 fingers in your wrist area po, ma'am, to count your beats per minute po, ma'am. to assess your heart rate or and circulation. So now is I will perform hand hygiene and observe the infection control and then gloving to prevent infect spreading of the infections. So now we'll then go implement the protocols are protected from any harm or infection. So now I will do done gloving. So now I'll provide the client's uh, privacy to maintain her dignity. So now I will closing the door already for month to ensure your privacy and also let's retract for any nonsense. So now is I will allocate the pulse area normally in the radial was taken unless it cannot be exposed or other body area is need to be assessed to the ensure the proper detections can easily read the accurate reading of the pulse. So now po ma'am, can I see your pulse po? And then assess the pulse po, which is the ma'am. So ma'am, may I remove this things po ma'am? Okay. Okay. So now is I will assess the client's resting position. The yeah. So now I'm gonna assess the comfortable resting position of the client to ensure that she is comfortable and also ensures the accurate reading. So, ma'am, please sit down comfortably po ma'am with your feet, both feet is flat on your floor po ma'am to ensure that. Now is I'm gonna assess the radial pulse to ensure that it can speed text that. So so now in sitting position, I will bend the client's arm for about or elbow for about 90 degrees angle with the underarm or underarm is supporting with the elbow like this and also her palm of her hand is facing forward onward and downward and to inward and to ensure the proper placement of arm ensures the accurate reading. Okay, Puman, can you please put your arm here, Puman? Can you please sit down? Okay, so now 90 degrees and palm should be fit downward or inward. Okay, so now is I'm gonna uh, count and so now is I'm gonna count. So now as I'm gonna assess and palpate the radio pulse and count also and I'm gonna put my 2 to 3 fingers of my 2 fingers in the inner wrist in the thumb area in the upper down area of the thumb. So now is to ensure the proper proper placement of the fingers or the two thumbs ensures the accurate reading of the pulse. So now is I'm gonna count the pulse for about 1 full minute and records the beats per minute in the worksheet. So now Uma, let's count your okay Uma. Okay, wait lang Uma. Let's start. Okay, so now our record is in the watch. So now I will count the 1 full minute of the patient's pulse. So now, while detecting the pulse of the patient and real pulse, I also assess the rhythm and the volume of the patient's pulse, which is which is the rhythm was good and also the depth, which is also not. So now I'll document the pulse rate of the patients and the rhythm and volume of the patients to the patient's report to ensure the accurate and proper documentation ensures that future reference. Okay, for how many beats per minute po, which is uh, EPM po, your rhythm po, it's a normal, and your deep po, it's also good po. So now let's proceed to respiratory. So now is I'm gonna first is I'm gonna do a perform the step 1 to 3 assessing the temperature. So first I'm gonna uh, introduce myself, verify the client's identity, and explain the procedure. So to ensure that the client's the correct client's identification is also about the trust. Good morning, Puma. Good morning, Puma. My name is Jugasan. I'm a nursing student. So for today, Puma, for verification, Puma, may I have your name and birthday po?
My name is Donna B. and I was born in April.
So for today, Puma, is I'll be accessing the partner, which is I'll be having your breathe permits, Puma, assess your lungs, Puma, and also your breathing, Puma. Now is already provide the class or explain the client's procedure. Now is I'm gonna perform hand hygiene and then gloving. So I already done the gloving too. So you just imagine I already done the gloving. So now is I'm gonna provide the client's privacy to ensure automating the client's safety. So I already closed the door to ensure her privacy. So now is I'm gonna observe a complete respiratory rate or palpate respiratory I breathe and counts for about constant respiratory rate for about 60 minutes. 60 minutes. Okay, so also I'm gonna observe the depth and the rhythm of the patient's respiratory by inspecting or observing his movement of her chest. Okay, Puma, just normal, breathe normally, Puma, because I'm gonna inspect for about 60 seconds. Po. Okay, so now is I'm gonna document the respiratory rate and also the depth and the rhythm uh, of the patients on the records of the client's records to ensure that because proper recommendation ensures the monitoring of the patients. Okay, Puma, your respiratory illness with Puma, and also your death and different Puma. So now let's proceed to blood pressure. So blood pressure. So first is I'm gonna ensure that all the equipment are in the are intact and properly functions, and check the size of the cuff of the valve of the cuff, and the length of the tubing between the cuff of the sphygmomanometer, and also to ensure that the equipment is in good condition to ensure the accurate readings. So now I'm going to check the cuff and the liquid in the tubing with good condition. Also the stethoscope. So now is I'm gonna make sure that the client is not smoking and also indigested the caffeine and doing not activity before 30 minutes prior the measurements or the examinations. So ma'am, may I ask, ma'am, may I ask you, ma'am, did you smoke po ba?
No po.
How about indigested caffeine po like tea and coffee? Okay, so ma'am, did you do activity po ma'am? Like prior this measurement po, like jogging kami here po mo, with time, no. Okay, that's good. So now is I'm gonna identify the area or the arm which is to use to ensure the accurate reading, and also and also prevents the arms where is injury or other health conditions. So mommy, I check the bones for one to check for to use one of blood pressure. Okay, so we will use this part for now. So now is so now in the so now in perform so now in I will perform the clients or position the clients appropriately, and with the arm of the clients or the client should be specified, and both the feet of the client should be flat on the floor, and the elbow of the should be slightly flexed, with the palm of the hand is facing up and the arms is supported with the heart level, and to ensure the upper arm is ensures the proper positioning is ensures the accurate measurements of the patients and also patient's comfort. So ma'am, please sit comfortably po ma'am with your feet flat on the floor po ma'am, and your arm is supported the table and the level of your hand po. Okay, and also your palm is facing up po. Okay, so now is I'm gonna wrap so now is I'm gonna wrap the cuff around the upper arm of the client, and locates the brachial artery, and applies the center of the bladder directly to the over the artery to proper placement ensures the accurate reading and detecting the correct pulse point. Okay, for mom, so now is I will work this uh, this thermometer in your arm spot. Mom, I will put up this your mom to ensure that. Okay. So I will put my two fingers, ensure it is correct size, or it is not to ensure the patient is not in discomfort. So which is a good size. So now is I'm gonna position the stethoscope appropriately. So before that is I'm gonna cleanse the surface of the stethoscope using the aseptic wipe to prevent cross contamination with that patient. Okay. So now is I'm gonna insert the ear attachments to my ear with the they tilt slightly forward to ensure that the better sounds insert to my ear. So now is I'm gonna ensure that the stethoscope is free from the ear to diaphragm to avoid the noise interruptions. Also is I'm gonna place the balls or the diaphragm of the stethoscope to the amplifier of the stethoscope over the bronchial pulse, which is detects the high pitched sounds. And now I'll place also the stethoscope on the direct on the skin of the patients, not the area of the clothes, to avoid less detections and ensures the detection of the sounds. Why is for the why hold the bell of the why hold the diaphragm of the stethoscope? My thumb is pointing on the bell of the stethoscope and the index finger with the rest of the fingers are supporting the elbows to provide stability. Like here, like like um, like here's my closer. Like here. So now I'll put it direct to the skin of the patient. Okay, please brush out. And also, I'm gonna provide the supporting the rest of the figures is supporting the elbow of the patient. So now is I'm gonna auscultate the I'm gonna auscultate the client's blood pressure to ensures that I can assess the systolic and diastolic of the patient's pressure. So now is I'm gonna pump up the cuff. So now is I'm gonna puff up the cuff of the stigma Bitter. Stegmo Stegmomonamometer. So now is also our rates. It's 30 millimeter mmHg, which is millimeter of mercury above the points or the bronchial pulse is disappeared. Ensures it is the cuff is inflated enough to get the accurate accurate systolic reading. So now is as I release the valve of the cuff carefully uh, so the pressure is decreased. The rate of the two or three mmHg, which is millimeter of mercury, per second to allow the precise detections of the sounds. As pressures falls, as the pressure falls identified as systolic, which is the first sound I hear, and also the diastolic, which is the last sound I hear. So let's now is I will deflate the cuff rapidly and completely to prevent the prolonged arm compression. So now I will perform this. One is so now start to puff off the cuff. Ensures that the cuff is off. Ensures the accuracy. Now I will release the cuff carefully. Okay, so now I will release the cuff completely. Okay. Okay. So now is I will. So now as the so now is we will wait 1 to 2 minutes before making further measurement allows the blood flow to the arm. And now is I will remove the cuff of the client's arm to ensure the patient is comfort and also prevents pressure in the arm. So now is I'm gonna wipe the cup with approved disinfectant to prevent cross contaminations between the patients. So now is I'm gonna document the reports or the document and reports uh, the blood pressure done by done according to agency policy to accurate documentations ensures proper patients monitoring and treatment planning. So now is I'm gonna disinfect the stigma manometer. So now you just imagine I already disinfected that. Now I'll document. So your blood pressure po ma'am was a 120 over 1 over 80, which is good. Okay. So I think that's all po ma'am. Thank you for your cooperation.